Hey everybody, welcome again to Create Your Health. My name is Peter Bedard and we're about to go in and meet Guillermo Brzostowski, who is an EMDR specialist. Let's go inside. Guillermo! We were just gonna go inside.
Come in.
Guillermo, you are an EMDR specialist.
Yes.
Tell me, what is EMDR and how does it work?
EMDR stands for eye movement desensitization and reprocessing. And basically, it works with your body into releasing traumatic experiences.
What's the process that you go through before or getting into an EMDR session?
Well, the usual protocol is for a couple sessions, we will be discussing what are the issues that affect you. And then once that we're getting to the session, what we will do is there's a follow-up protocol where we will identify an issue or a memory.
Okay.
And then we will be looking at the image that the person may have
About that issue.
about that issue. We will just check and see where your emotions are located. And then basically we identify the negative cognition, the negative feeling you get about yourself because of that circumstance. When the brain has to react to tense situations, what comes in is the amygdala, which is a part of the brain that is inside
The
in
base.
the back. Right, that part of the body doesn't have a clock. So sometimes we're carrying that trauma 20 years later, and we go into whatever this message was. This technique, in a way, allows you to process things in the body that are not verbalized.
So by
There's
following
a-
the eyes, following the
right,
fingers is
right,
what creates the bilateral movement. And that somehow activates that part of the brain?
Right.
How can somebody having an incredibly, traumatic experience in their life that follows somebody's fingers and suddenly the emotion is released and gone and it's not an issue for them anymore?
They don't disappear, but you look at them and it's like a movie. It's like, wow, but they don't affect you.
So what it does for you is you get sort of an objectivity about the trauma where you're not in it anymore.
It's like being in a train watching the things go by.
But what do they come to you for and want to use the EMDR with?
And the biggest one is like trauma by soldiers, which is how it started being applied.
So when you say trauma by soldiers, you mean post-traumatic stress disorder?
Right,
Okay.
PTSD. What happens sometimes during the session is that people start moving part of their bodies.
Oh, really?
Either they move the legs, or they move the arms,
hands.
the hands, and they don't even notice it.
So it's almost like the emotional stress is coming out
Of the
and
body.
being released through a physical reaction.
Sometimes people cannot express what the feeling is, but they can express what the body feels. Some people have it very clear. I had a car accident, the car hit me on the side, I froze, and then you work from there. And that's, I'm scared to get into a car.
Right.
And what do you feel, how you feel it, and then you start doing the bilateral movement.
Okay.
Which, as you said before, it can be done like this. It can also be done by tapping, and also can be done with this little machine that is a little easier for both.
Well, that's perfect. Let's go right into it. Here we go. So I'm gonna put this on.
And then you do this.
Okay, so
So-
that's what you mean by bilateral. So
Right,
I'm
right.
getting a sound here and a vibration, and then it moves over to this side, and it affects the two different
then
parts
we'll-
of my brain. People know that if they do feel an emotion or
Well,
something comes up,
first
that they
of-
can stop.
You just raise your hand, or you
Okay.
say stop, and that's the end of that.
Something really upset me where the city came in and waived all of our public hearings and all this kind of stuff. And I don't know why this still bothers me.
And when you talk angry, you feel the anger someplace.
I feel it in my throat. I feel it like right in through here. Yeah, as I'm talking about it, my throat feels constricted and tight, and my blood pressure rises. It's like your attention goes from one side to the other side, and one side to the other side, and it's almost like you can feel it in your head.
When you think about that first image where you were concentrated, the city waving, you getting angry,
Right.
how disturbing do you feel now about it?
I don't feel angry about it anymore. Because you're feeling the vibration in your fingers, or I was feeling the vibration in my fingers, and I'm hearing these beeps in my ears. It was pulling me out of the past. It felt like I couldn't stay in the past about the moment because I'm having a physical experience. I couldn't hide in my head.
Sometimes during the work on that, some other things come
So,
up.
right, I would imagine it could lead you to maybe a deeper trauma. Well, Guillermo, thank you so much
Thank
for
you
sitting
for
down
being
with
here,
us.
and thank you for being such a great patient.
Right. Well, I appreciate your being with us, and thank you again for watching another segment of Create Your Health.